Well, let's return to our top story and reports that the UK has decided not to join the EU vaccine purchase scheme. Joining me now from his West Suffolk constituency to talk about that and much more is the Health Secretary, Matt Hancock. Good afternoon.
Good afternoon. How are you?
Very good, and thank you very much for joining us on Times Radio. Just to confirm first, is the UK opting out of that EU scheme on vaccine purchase? And if so, why?
That's right. We've chosen not to join the EU scheme on vaccine purchase. And the reason is that it wouldn't have allowed us to have a say in the vaccines that were procured, the price, the quantity, or the delivery schedule. And we've got a very sophisticated domestic program, UK program, both of developing the vaccines, and we have two of the most developed vaccines candidates in the world, including the one that's widely recognized as the most advanced, the Oxford vaccine. But we've also been putting in place contracts with other vaccine developers globally to make sure that if another vaccine from around the world comes off first or can add to the program and benefit people here, then we'll have access to that. Rather than disrupt that program, by joining an EU scheme where we wouldn't have had any say in all those matters, we're carrying on with our own.
Well, how many vaccine companies would you say that you're in discussion with around the world?
Well, we regard there being around 10 front runner vaccines. We think that there are over 80 total vaccine candidates, potential vaccines, of which 10 we think of as front runners, and we're engaging obviously with all of those. In some cases, with those discussions are very advanced.
How many would you say are advanced?
What matters to me as health secretary in taking a decision like this is what is most likely to get a vaccine delivered safely into the UK population as soon as possible, and it's on that basis that we've taken this decision.
And how many of the 10 would you say are you're in advanced discussion with?
Well, I'm not going to go into where the commercial negotiations are up to, and you'll understand that I wouldn't want to do that. But they are the 10. We're fully engaged with 10, and we have a big program on this being run by Kate Bingham, who's come in and is absolutely running this program brilliantly. And we are further ahead than the EU schemes are. And so we would have joined the EU scheme if they had allowed us to also continue with our own negotiations. But one of the conditions of the scheme was that we would have to stop our own negotiations and only do them through the European Commission. And we weren't prepared to do that. We think we'll go faster this way.
Clearly, you see it as a smart move, but is it also a bit of a gamble, would you admit, opting out of that collective buying power of the EU?
Well, we think that because we're further ahead, actually the risk would have been to stop the UK procurements and instead be required to only buy through the European Commission route. And, I think it's actually better to be able to continue with the work that we've been doing, and not least because we've got two of these top candidates here domestically. Countries around the world are keen to engage, and the approach that we're taking also with the British schemes, which are the British vaccine candidates, is to give them all the possible support to go as fast as they can, but also to say that if they can, so long as they can manufacture enough that we need here in Britain, they should also be manufacturing for the whole world. We should take a global attitude to this, and whichever vaccine comes off first, we should have a global attitude to trying to get it to as many people as possible according to clinical need. But obviously, as the health secretary in this country, you'll understand that my absolute top priority is making sure that it's available here.
And just very briefly on this before we move on to other issues, the Wellcome Trust was saying that they hoped that the UK government would join the CEPI-Gavi Global Vaccine
Yes.
Initiative. Can you confirm you're going to do that?
Yes, and in fact, we're the biggest financial contributor to to that international search. We
Right.
use our international development money to make sure that that if a vaccine comes off, and it is, remember, still an
Mm.
if it comes off, then it should be available, including to the some of the poorest countries in the world. So there's many things that can be said about the UK response to coronavirus, but one of the areas where we really truly are world leading is in vaccine development
Okay.
and the treatments. We're the only country that's come up with a treatment that is known to work, and both in terms of the domestic science behind a vaccine and making sure that we're putting money into making that work available around the world. We are right at the front on this.
You emphasise, and the Wellcome Trust also emphasise, that it's still a big if we get a vaccine.
Yeah.
So in the meantime, obviously you've got to be cautious about how much you're opening up, how much people are getting back to normal in inverted commas.
Yeah.
So we had pubs and bars reopening last weekend, gyms and nail bars coming soon. Why are you embarking on a second phase of reopening when it is still too early, really, to see definitively the impact on the infection rate of the first phase, pub reopening?
Well, we're being very careful and very cautious, step by step, and the whole of the UK is moving along the same journey, and then at the same time, we're also prepared to take action, targeted action, where we see a problem, whether that's in an individual hospital or pub or GP surgery or school, or in the case of Leicester, when a city is not seeing the numbers come down. So, that move from the national approach to the local approach is very much the way I see the next few months panning out.
But do you see a
Um,
problem in the R rate in England edging up from, it's now zero point 0.8 to 1, isn't it? Which is, significantly up on last week.
well, it is still below one, which is
Just.
well, yes, but critically below one, because that's the rate at which anybody who has it on average gives it to fewer people. As in, if 10, when it's at 0.8, if 10
Mhm.
people get it, then they give it to only 8 people catch it. And with test and trace getting better and better, as we've seen in the figures published yesterday, we're able to find more of the people who have it. The
I
single
just want to
biggest
come back to
challenge of
test
this
and trace.
virus
Can I just ask
is,
on that R rate, though,
yes, of
that
course.
you don't sound too concerned about that R rate edging up?
Well, it's very important that it stays below 1, but it also is important that we have more and more targeted response, so that where there is a cluster of cases or an outbreak, then we can absolutely leap on it.
Is there anywhere
And
that's worrying you at the moment in terms of a local spike?
well, yes, Leicester,
Apart from Leicester,
and
I mean, sorry.
where we've taken very considerable action. And then yesterday we published the list of the 10 highest local authority areas, and in each case we're giving them the support that every support that we can, including putting more testing in, for instance, and there's constant vigilance for areas, whole towns or cities where there might be a growing problem, but also then in a much more local area. And the biggest challenge of this virus, the single biggest problem of it, is that it passes on asymptomatically, and this asymptomatic transmission makes it incredibly difficult to track. But we're now managing to find more and more of the cases as a proportion, even as the cases come down, that gets easier to do.
Well, you're
And
only
it's that
reaching
it's that
70.
targeting that really matters. Like, I thought
Yeah,
when 3 pubs shut on Monday, I'm sure the owners of those pubs did exactly the right thing.
yeah.
And that is the system working, right? Because that's saying, instead of shutting all pubs, we'll shut the ones where we know somebody who's tested positive has been.
Well, except it was their own system working because they diligently got on the phone and called all their customers. Your system is only reaching still 70% of close contacts of people who have tested positive. Just want to ask you, when will it be world class?
Well, it's getting better all the time, and the figures published this week showed that. And it was the combination with these pubs. It's a really good example. NHS Test and Trace was involved, and then the pub, in each case, got in contact with the people who it had registered the names of. That's
Mm.
that's the system working well together.
But when
So
will your system be world class?
As soon as possible is the answer. It's all about getting. We built it. It's working. 160,000 people have been isolating because of it, who wouldn't have known that they were high risk cases, high risk of having caught it before, and it's getting better all the time. I think the fact that 97% of people now get the test result either that day or the next day, the turnaround times are getting better. The number of people who are isolating as a result of it is increasing. We're getting a more and more targeted approach, and that means that we can then have some of the freedoms, like being able to reopen pubs. But this is all a balance, and the
Yeah.
truth is, the more people stick by the rules, the easier it'll be for everybody.
So will the Test and Trace app be ready by the end of the year?
I'm highly confident it'll be ready by the end of the year. I want it to happen sooner than that. We're working very closely, and after a bit of toing and froing, we're working very closely with Apple, who have now engaged very well on making it work.
You had the Chancellor earlier this week encouraging people to get back to sort of more normal behaviour. Given the scale of the economic damage being wrought, 7,000 retail jobs lost just yesterday, do you think, as Health Secretary, are we going to have to live with a higher rate of infection in the near future to try and avert even more economic hardship, which obviously has a health consequence too?
So I just don't see this as a trade-off. And the reason is basic maths, that if the number of cases is increasing, then unless we act, it keeps on increasing.
So it's
Um,
still got to be the R rate of 1 is still the guiding principle, whatever the economic damage.
and then taking the local action to try to
Mm.
clamp down on cases where you see them, and that's because otherwise, eventually, you end up with it really taking off, like we're sadly seeing in some states in America and in Latin America, and some other places. So yes, we've got to keep it under control, but at the same time, then relax as much as is safely possible on the things that make life worth living. And people say, aren't you just looking out for the health things, and isn't Rishi Sunak just looking out for the economy? And it's just not true. You've got to look at both. And I think I think this week he's done an absolutely incredible job in terms of the economic support that's going in. But you've also got to keep the virus under control at the same time. The two go hand in hand.
And one way of keeping the virus under control is clearly wearing a mask, a face covering. You've been pictured wearing a mask. Would it help promote more general mask wearing by the public if more ministers were to be pictured wearing them?
Oh, I don't think that's a conscious decision. I'm in health settings a lot, and the rules are really clear, aren't they? That if you're in the NHS, you need to wear a mask. If you're on public transport, you need to wear a mask. If you're in shops, it's recommended in some shops, but it isn't mandatory.
What about
And
if you're serving food to people you've never met before?
sorry.
What about if you're serving food to people you've never met before?
Well, if you're only momentarily in contact with them and not in very close contact, then that is fine. So,
So the Chancellor was okay not wearing a mask,
I thought that I'm
carrying
certainly
plates
not.
of food.
Yeah, I'm not going to. I thought you could tell that Rishi was a waiter when he was paying his way through university.
Well,
The
there was no
natural
need for
flair
masks then.
of a born, of
Yeah, but
somebody with experience.
seriously, does that make you feel a little bit, as the health secretary, and you know what the government guidance is? Did it make you feel a little bit squeamish that he was carrying out plates of food to a few strangers without wearing a mask? Would it be
No,
nice
because
if he did?
no, I see the point, but it's not. If you don't, if you have good hygiene, if you don't linger, then that is
But would it help
then
public
that's fine.
confidence?
So the guidelines are there for a reason, and they're drawn up really carefully.
But would it have helped public confidence? Would it help public confidence to see the Prime Minister? He said that the government needs to be stricter on wearing face coverings in confined spaces, that the public needs to be stricter about it. Would it help to see Boris Johnson in a face mask, do you think?
Well, I don't know. I don't think I've never really thought about it. I think that
But
if he if
what has he got against wearing one? What are all these
well,
world
I
leaders?
don't think
What
it's
is
got
so
anything
bad
about.
about wearing a face mask?
Well, nothing. I'm completely relaxed about it, but I think that it's just it's a matter of the setting that you're in. It's a matter of where you are, isn't it?
Okay, so Boris Johnson has said that the public need to be stricter on wearing face coverings. Would lots of people travelling on trains don't wear them? Would you like tougher sanctions to be applied?
Well, it is mandatory. And so people absolutely should wear face masks if they're on public transport. I mean,
It's not being
that is part
enforced
of the
though.
deal, unless they've got a very specific exemption and a reason not to, and essentially a medical reason not to.
So would
Then
you
absolutely they
like
should.
tougher sanctions? Would you like transport companies to be taking more action to kick people off if they're not wearing face masks, or even a fine?
Well, there are fines. There are fines in place, and
But are they being applied?
well, I'd say from what I've seen, the vast majority of people are following the rules on public transport. But the rules are there for a reason, and that's because public transport is one of those high risk areas that we've opened up. We've kept open all the way through because it's so important. But it is higher risk, hence the need for a face mask, and those fines are in place.
Would you
And
encourage
people.
transport companies to use those fines?
Well, as far as I know, they are being used. But in the same way that we are checking that pubs and restaurants are following the rules and doing things right, in the same way the British Transport Police do on in terms of transport. So it's really important that people follow the rules especially on public transport and across the board. And ultimately, you know, that's how we keep control of the virus whilst also getting life as much back to normal as is safely possible.
And is it
And
possible that you could be forced to wear masks in shops in England as you are in Scotland at the moment?
well, here we should keep the evidence under review, and we should follow that evidence as we have throughout, and as we learn more about the virus and the evidence changes, so we should be prepared to change the rules, and that's been our attitude and our approach all the way through. And actually, we sometimes get criticised for it. People saying, "Well, hold on, why are you changing the rules now?" But the truth is, we're constantly learning.
Just a story that's just broken on the Guardian website. It says that Boris Johnson is planning a radical and politically risky reorganisation of the NHS amid government frustration at the Health Service's chief executive, Simon Stevens. You're quoted. A source close to you is quoted saying that you're frustrated how limited your powers are and you want to get some of that back. Is there any truth to this story of an upheaval?
Well, I haven't seen the story. What I'd say is that the one of the things that we've learnt through the crisis is just how important collegiate working across different parts of the NHS is. And we've got to make sure that we bring the different parts of the NHS together and remove some of the barriers that have held it apart. And some of that is in legislation, but others are just culturally different bits of the NHS. It's a team effort. It needs to be brought together. It needs to be more. There needs to be more cooperation across different parts of the NHS. That's what happened in the crisis. That's what happened when the NHS was under massive pressure. And it worked. We protected the NHS. It's one of the things I'm most proud of in this crisis. And people did amazing things. And that created a new way of working, which is much more about collaboration around a whole system, the NHS in a local area. I do want to see that continuing
But
long into the future.
specifically, The Guardian says that the Prime Minister has set up a task force to devise plans for how ministers can regain much of the direct control over the NHS that they lost in 2012 under the Lansley shake-up. Does that task force exist?
Well, there's a unit that is about health policy, but it's not specifically about this. So I haven't seen the story, so I
Hmm.
can't comment on it specifically. What I can tell you is that um, uh, we are. I am constantly looking for ways for the NHS to be freed at the front line to deliver better.
Okay.
I don't favour some big reorganization. I want to just make it as easy as possible for people on the front line to do their jobs. And there's a whole series of different areas where that's true, and we can free people up as we did in the heat of the peak to deliver for the patient and to make the services run as effectively as possible. So my
Sure.
message to everybody in the NHS is our job at the centre needs to be to help you to do the best job you can. And there's a whole heap of things that we changed during the crisis, during the peak, to make it that easier, to make it easier for bits of the NHS to work together. And we don't want to go back from that. We
Okay.
want to make that make that better way of working a permanent part of the system.
Couple more issues to raise with you before you go off with your. I know you've got lots of things to do in your constituency because you haven't been since the beginning.
February.
Yes, since
Yeah.
February. I want to come back to that just before we end. But just you've talked about allowing visits to care homes very soon. Now, the Prime Minister, as we know, has declined to apologise for saying that too many care homes didn't really follow the procedures. Given the discharge of thousands of patients from hospitals into care homes, inadequate PPE, inadequate testing, what do you think now about your comments in May that the government had thrown a protective ring around care homes?
Well, we put billions of pounds of extra money into the care system at the start of this, and we, in fact, reduced the number of people who were leaving hospital to go into care homes, and so there has been a huge amount of support that's gone in on PPE. That you're totally right. That was a massive challenge when suddenly demand for PPE, understandably, suddenly shot up and shot up around the world, and we had to scramble to get the supplies. And thanks to Lord Dighton, we put in place that system and we solved that problem. And that was true for care homes. It was true for the NHS. So I pay tribute to people who work in social care. They did an amazing job in looking after some of the most vulnerable people. So,
But nearly
and
20,000 people in care homes have died in England between March and June from coronavirus. That protective ring wasn't protective enough, was it?
well, I mean, my heart goes out to the families of each and every one. And of course, everybody would want that number to be lower. The good thing is that thanks to the work of people who work in social care, that number is lower as a proportion than any other European country. So
Mm.
they did do an amazing job, our social care providers, and we tried to support them as much as we could. The thing is that it comes back to this point about asymptomatic transmission of the virus. We learned that during the crisis. We didn't know that at the start. In fact, at the start, because it's not true of any other coronavirus, that it wasn't thought that if you didn't have symptoms, you could pass on the virus.
Right. Well,
And
except
so,
that that was sort of
learning
known
that sort of
about.
science
That
has
was
been
known about
important.
since January, though, that the
No, it
asymptomatic.
wasn't. No, if it was, by God, I wish we had known it in January, and
Well,
we didn't.
members of Sage circulated that theory since January.
Well, that's right, and the evidence that was presented was that wasn't the case. So they discussed it and decided that wasn't the case, or wasn't likely to be the case. And then we worked on it, and the scientists worked on it. I'm not criticizing the scientists at all. They were making the best possible scientific judgment based on the information that was available. So this is one of the absolute truths of responding to a pandemic, is that by definition this virus was new. It hadn't existed before, and we were working as hard as possible to understand as much as possible about it, and we still are. And then when you find new facts, you update what you're doing accordingly, and that isn't a criticism of anybody. That's science in action,
Very,
and policy making that's guided by that science.
just
It
very,
doesn't make it any easier in hindsight, but hindsight is a wonderful thing, Cathy.
just very briefly. When will that social care green paper be published? That's been long promised.
I don't know. we were about to, and then the crisis hit, and I've been working on it since then. So I hope too soon. I mean, if any, but the crisis has clearly shown that
So
that it's needed.
delayed, but hopefully not for too long.
I hope.
Okay. Just finally, then, I know you've got to go and get on with your constituency business. It is the first time that you're there in Suffolk since the lockdown. I just wanted you to just reflect on the last few months, which
Yeah.
clearly have been absolutely momentous for all of us. What is the toll that the pandemic has taken on you, would you say?
Oh, that's not how I feel about it at all. Um, I feel like I've learned an enormous amount. Um, I've definitely got a few grey hairs, um, um, and it's been very tough. But always felt um, I've always felt like we're making the best decisions we can in difficult circumstances based on the best information. And there'll be a time for looking back and asking with hindsight what you would have done differently. But with the information that we had at the time, we just made the best judgments that we could. And so I'm quite by nature I'm quite an optimistic person. I look forward, and so I'm still in that mode. I'm very much always looking and asking what's the next thing, and I suppose that's what keeps me going through something that is inherently extremely difficult to handle.
I mean, are you haunted, though, by the number of people who have died, tens of thousands of people?
Well, you can. It depends whether you're a glass half full or glass half empty person. My heart goes out to those who've died, and I've lost friends and people I respect, and I've seen the toll, and I've seen also the toll on some people who have survived but have long-term consequences, which I think is going to be something of growing importance for us to look at. But I also, I remember back to when we were told that 500,000 people were going to die, and we prevented that. And I remember being told in terms that the NHS was going to be overwhelmed and there was nothing I could do about it. And we stopped that from happening. We built those Nightingales, and the London Nightingale was built in 9 days. So
Have you had a chance?
of course there's things that you learn, but there's also things that we did that averted something much worse.
Have you had a chance to grieve for the friends you've lost?
I probably haven't taken any time out, frankly, since February, and there'll be a moment for that.
Do you? How much sleep do you get a night?
I'm very, very. I think very hard about this and work very hard at it. I always try to get over 7 hours sleep, and most of the time I manage it.
Wow.
Of course, until last week, all social life was off as well. So that made it easier to work all that in God's sense. But
you getting on a plane for the summer holidays?
No, I'm going to Cornwall.
Matt Hancock, enjoy your break when you get it. Thanks very much for joining us on Times Radio.